I'm Angie.
I'm Kylie.
I'm Bla.
I'm Bessie.
And today we're going to be talking about maternal health during prenatal care among low-income women in Merced County. And Bla's going to start us off with the demographics.
So jumping into the demographics of Merced County, it is one of the regions that are mostly impacted by a lot of economic, social, environmental, and health changes over the last decade. And one particular impact that we have found to be the most affecting of the populations are the high rates of infant mortality. Therefore, we chose to focus on maternal health during the prenatal care among low-income women of Merced County. Between the years of 2006 to 2008, 1 out of 157 infants in Merced County was recorded who have died. This made the county one of the top 58 counties of California to have the highest infant mortality rates. According to the U.S. Census Bureau of 2010, 21.8% of the Merced County population is living under the poverty level. This means that they are 200% under the criteria. The diversity of the county includes Hispanics, white Caucasians, Asian or Pacific Islanders, and other ethnicities. For the Hispanic population, it consists of 53.8% of the population. For the white and Caucasians alone, this makes up 33.1% of the population. Asian or Pacific Islanders are 7.3%. African Americans make up 3.6% of the population, and other mixtures of races total a percentage of 2.2%. We decided that to be able to reach the highest amount of low-income women in Merced County regarding their prenatal care, we wanted to work with the Women's, Infants, and Children's Agency in their nutrition education programs for pregnant women, their infants, and beginning mothers. What the agency does is that it offers supplemental nutrition programs to aim and promote healthy living through nutrition education for pregnant women as well as infants. With the high prevalence rate in infant mortality in Merced County, we wanted to see if each of the ethnic populations are efficiently receiving adequate education in their prenatal care. The goal of our health awareness program is to reach a reduction in infant mortality, and also the mission for the health awareness program will be to strive and provide direction for the best quality care for prenatal services available at WIC's maternal or child health programs. And Bessie will be presenting on a comprehensive aspect of the health education program.
Prenatal care is crucial to ensure the healthy development of the fetus and providing knowledge to the mother to improve health behaviors. Maternal health at the time of conception is an important determinant to the overall well-being of the parent and child during pregnancy. The complex relationship between maternal nutrition and birth outcomes emphasizes the need for consistent and thorough assessments of women's diets throughout pregnancy. The psychological stability depends on social support and familial relationships, which are key elements that influence physical health. Health in general shows correlating patterns with the socioeconomic status, and Healthy People 2000 objective was to significantly reduce infant mortality across all racial, economic, social, and socioeconomic groups. So this means that there are visual existing barriers that lower income women face during pregnancy. So preventative and health promoting behaviors in pregnant minority women can be used to develop approaches to encourage healthy lifestyles.
So some of the national statistics for maternal and child health are that 8.1% of births in the United States have a low birth weight, which is anything less than 5.5 pounds. And a low birth weight can make the infant more susceptible to developmental health issues. 12% of births in the U.S. are preterm, meaning that they've occurred prematurely, and that can affect their overall health as well as their developmental progression.
Okay, so the impact of the condition on the community that we've selected, high infant mortality rates is obviously going to give the community a negative reflection, and it shows that there are some areas that need improvement within the community. California as a whole has low infant mortality rates, and that has allowed community leaders to see the positive effect that spreading awareness about prenatal care can have. However, Merced County has yet to be affected in the same way that California has, based on the significant differences between California's rates of infant mortality and Merced County's rates of infant mortality. In researching how high infant mortality rates affect a community, there was a theme that came up, which was teenagers and prenatal care. The Merced County Action Board Strategic Plan for 2013 to 2018 shows that there is a significant prediction that the community's quality of life will be lower when there is a high instance of teenage pregnancy. So basically what we have here is kind of like a poverty cycle. The teenagers in Merced County are low income and then getting pregnant and then not having access or thinking that they don't have access to prenatal care, and which is definitely contributing to how high Merced County's infant mortality rates are.
Going into health implications, the first thing that we need to look at is taking care of the mother and any pre-existing conditions that may harm the baby. Since there is a high rate of low-income women who do not have knowledge of the services offered in their counties, there needs to be more emphasis on primary care so that there is a reduction in health-related complications that could stem from late or no prenatal care. Going into medical implications, for an effort for us to make sure that all expecting mothers are receiving timely prenatal care, research has found that women who do not have health coverage are less likely to seek prenatal services. From here, we see a distinct correlation between a large population of low-income women who are uninsured and a lack of pregnant women receiving medical treatment and who do not receive adequate prenatal care, leading to unhealthy pregnancies.
So I'll be talking about the economic implications of this health issue. So the nation's economic development is connected to this health issue because children are an investment into the future of the U.S. and its economy. There is a direct relationship between population health and economic development. And so we view health as an economic engine because in a healthier population, a smaller proportion has available funds that are required for current health care, making more funds available for investment and other needed infrastructure projects. So another effect between maternal and child health in the economy of the U.S. is formal education. Unhealthy children are not prepared for school, miss more days of school, attend school for fewer years, and learn less when in school. Education for children is associated with more job opportunities, higher wages, and life skills. So having poor education for a child limits their opportunities and restricts the growth of the economy. And that was some of the ways that this issue has some economic implications. And Kylie will be estimating.
Okay, so I'm going to be talking about how cultural beliefs can affect prenatal care, and the community that we chose was the Hmong community. And we found that a woman's cultural beliefs and values can highly affect when a woman seeks prenatal care. A study on the Hmong population in Merced County was conducted, and it gave a detailed insight into the common health barriers and health behaviors within the Hmong community. And according to the survey, a common barrier was the tendency for Hmong women to feel uncomfortable speaking about women's health issues in front of men. So it was kind of a deterrent if a woman felt that maybe she was going to have to be speaking with a male doctor to go seek prenatal services. But we also did find that the newer Hmong generations of women are becoming more assertive about their own health, which is definitely a positive change in that culture. On top of that, many of the participants felt that language barriers led to an overall lack of understanding between patient and healthcare staff. So there were 11 barriers listed in the survey that was given to the Hmong population that took the survey from Merced County, and the participants in the survey felt that a lack of understanding about Hmong cultures and traditions ranked fourth on the list of the 11 barriers, and that was just behind not having health insurance, not having child care, and a lack of time. Based on the survey that was provided to the Hmong participants from Merced County, it's very obvious that their cultural beliefs and attitudes have greatly affected when or if a woman will receive prenatal care. And now this is good.
So the health education for this target population is crucial to making a positive impact on their lives. Ultimately, there needs to be a behavior change that will allow them to feel empowered about their well-being. Despite being from the lower income level, this target population does have access to health services that can make an immense difference on their outcome of the pregnancy and on the lives of their family. So this target population not only needs to be educated on the services that are available, but also on health behavior changes that will improve their pregnancy. For example, knowing how to budget and select a variety of nutritional foods is a skill that can be acquired by being taught and practiced. Ultimately, the approach of our health education is to improve life skills that the woman can adopt to better conduct their pregnancies and to experience positive pregnancy outcomes. The program seeks to have a reduction in the rate of infant mortality and wants to educate on methods and techniques that will encourage mothers to change their behaviors and increasing the likelihood of child survival. This program will consist of a combination of outreach services to increase enrollment and an educational component on maternal health for the lower income women of Merced County. The theoretical model that was used as a framework for this program was the Diffusions of Innovations, which was created by Everett Rogers. This was applicable to our program because the central point of the theory is that with the adoption of new ideas by a population follows a predictable pattern. So we needed it to be a cultural and community norm to seek prenatal and maternal care. So the four main elements of the theory which were combined with our program was innovation, communication channels, time, and the social system. So in applying the theory, we wanted a desired outcome with the desired pattern, which was people knowing about our program, seeking the education, and actually making a behavior change. So being invested at community events and earning the trust from the community members, the message of free prenatal and maternal health care would spread through social groups. So we really needed the support of the community to perpetuate our program. And next, Kylie will be speaking.
Okay, I'm going to be speaking on the goals and objectives. Our main goal is to reduce the high rates of infant mortality among low-income women of Merced County, and our SMART objectives are based on 3 learning domains: affective, cognitive, and psychomotor. The first objective is based on the affective learning domain, and the first objective is to reach out. We'll do an outreach program through the diffusion theory to inform the community about free prenatal care provided by the WIC program by participating in events like social events such as health fairs within the community. And that goes with the affective learning domain because that is based on feelings and attitudes. So while we're at the health fair, we'll be able to gauge the community's vision on prenatal care, how important it is, what they believe about it, what their culture says about receiving prenatal care. And from then, we will try to work with them on how we can get them to see things our way and show them that prenatal care is beneficial to them. The second objective is by December 14th, 2012, WIC will have an increased enrollment of 25% of low-income women into their prenatal programs in Merced County. So that will go with the cognitive learning domain, which is the core learning domain. So while we're at the health fairs, while we're gauging how the community feels about prenatal care, we will try to educate them on the importance of prenatal care and show them that it can only be beneficial for them and the health of their child. And the third objective is that low-income women will make changes in their prenatal behavior by gaining knowledge of the importance of prenatal care and changing attitudes and beliefs about prenatal care in the WIC programs. So that will go with the psychomotor learning domain, and which is performing motor activities to a specified level of accuracy. So once we have gotten to the community, we have raised the numbers of the participants in the WIC program by 25%. We are now going to be teaching them different prenatal care behaviors that will hopefully be lasting behaviors and will trickle throughout the community so that we will have definitely a much lower rate of infant mortality. The next part I'm going to be talking about is the program approach. We are using the diffusion theory to reach our goal, and that is through attending health fairs, like I said. However, awareness is just a portion of our program. We're also focusing on education, but this is not an education program. We want to make true behavior changes in terms of prenatal care. We want those to be made throughout the community, and we'll be using WIC's existing programs because they are already an established organization within the community, and we know that they would be able to make that happen for us. And some expected problems that we will most likely run into, like I said before, were cultural issues and beliefs about prenatal care, going back to the mom community, how they feel about prenatal care, and barriers to access. Another thing was family support, especially for teenagers, was something that we came across. The less a family supported a woman's pregnancy, the less likely she was to receive prenatal care. So we would want to definitely reinforce family support. And then the last thing would be transportation. That's a very common low-income issue. That would basically stop our program in its tracks, because not only would that prevent people from getting to the program, it would prevent them from getting to the social events in which we'd be educating them in the first place, and that is where our program starts. So that's something that we would definitely want to look into. And now Anju's going to.
So I'll be talking about the evaluation methods today. The three measures that we have chosen to go with is a key informant interview, a public opinion survey, as well as the use of statistical data for the county. So the first, the key informant interview is with Karen Gilligan, the director of Merced WIC, and we will be getting information from her about the enrollment numbers before the program and the enrollment numbers after our educational awareness program. The public opinion survey is a survey that will be given in-house and online at WIC, and it'll be something that's given to first-time enrollees during one-on-one sessions with a WIC staff member, and it'll be able to gauge the awareness, effectiveness, accessibility of the program. The registries and county health data is something that is produced that assesses the prenatal and maternal and infant health. And so with this, we'll be able to see the numbers of infant mortality before the health program and after the program, as well as varying factors of and indicators of health status for mothers. In order to evaluate these evaluation measures, we'll be pilot testing each one of these measures, and we're going to be doing this by going over the wording, clearness, and content of the key informant interview, as well as the public opinion survey. So before anything's published, we will be going to an editor and fellow colleagues to have them review this so that we put out something that that is great for the public. We'll also be determining how long the interview and survey will take to complete. And as for the county health and data statistics, they already go through rounds of pilot testing, peer review, and analysis before publication, so it doesn't require any further pilot testing on our end.
Stemming from the methods that we're using for evaluation, I'm going to explain how we're going to be collecting the data. And the plan for collecting data for key informants will be immediate because it is a face-to-face interview, and we will be writing down each answer as each listed question is asked. One important advantage of face-to-face interview is that it allows time for additional questions that we may need to have a better understanding of why and how the agency's services have impacted the low-income women of Merced County. So going from there, the public surveys will be included in the first-time enrollee applications, and this will make us be able to find out how each client found out about the service, whether it was through our program and if our program was effective. Lastly, using the county health data census online is a form of collecting the secondary data to see the relations between this data that we find online and from our actual conduction of each key informant interviews and public opinion surveys. So for data analysis, after collecting all interviews
and hard copy surveys from the participants through the health educators of the WIG programs. We plan to use an online source. This tool is called surveymonkey.com, and this particular online website is free, and it will help us into analyzing the correlations of the data that we have found through our research. It also will enable us to see the implications and why the high infant mortality rates and qualitative data and quantitative data are related.
The program recommendations and changes that we would like to see in the future are the expansion of the program being suited to larger cities and even possibly a statewide campaign. This program expansion would require a larger budget, utilization of several media outlets and health professionals, public speakers, and medical professionals. So we'll also focus efforts on recruitment of public health nurses that are bilingual. With our key informant interview with Karen Gilligan, it did reveal a need for public health nurses, especially those that speak more than one language. That way they can connect and communicate with community members of all types. So some of the results in relation to the needs of the selected population, this program directly correlates with the needs of Merced County, just because, as stated before, Merced County has some of the worst infant mortality rates in the state. So this awareness and educational program was designed to improve these rates by tackling the root of the issue in our eyes, which is access to prenatal care.
Demographics, according to the data that we found through the Census Data Bureau.
What?
Based on the survey, it's very obvious that it's okay. No, you can look. So, based on the survey, what are you talking about?
Health education.
Okay.
Oh, it says, oh, I'm sorry.
Yeah, I'm introducing Bessie to continue. I don't know what she's talking about.
Alright, cut. Alright, my next is bringing awareness to the community and to give our target. Oh, I'm not even in the camera. Okay, let me stand on this side so it's easier. I wasn't even in it.
And we'll also be able to see, we are done with that discussion.
No, it's not.
And Bob's going to start us off with the demographics.
Sorry. Well, actually, I do think we need to delete
I was
it.
fixing my hair, but